Welcome to Quantum Alchemist Master Podcast. In this space, we share our journey in the awakening and integration process without judgment, building an all-inclusive community of awareness, love, support, and full acceptance. Reminding you that you are the master, you are the healer, you are the medicine, you are a divine, infinite, multidimensional being. You are source in human form. We all are. Everything you seek outside of you is inside, inviting you to go within so that you remember who you really are. Step into your true potential, create your own reality, and contribute to the reality of the collective. The change starts with you. We're all one, and love is the answer.
Good afternoon, Dr. Jawad. Welcome to the Quantum Alchemist Master Podcast. It's amazing to have you here today. I can't wait to hear a little bit about what is it that you do right now and how you started your journey to get there. Would you like to share with us a little bit about that?
First of all, thank you for inviting me, and it's nice to meet you. So, about me, I'm Dr. Jawad, and I belong to Pakistan. I live in a city that is a bit, you can say, less resourced area of the country. I graduated in 2004 as a medical doctor, and later I did some training in different medical institutes regarding surgery, regarding medicine, and then I did my MPhil in obstetrical and gynecological ultrasound. And I've been practicing for over 17 years now. So my main area of expertise is ultrasound, diagnostic ultrasound, and particularly regarding obstetrical and gynecological ultrasound. For the last couple of years, I initiated breast health and cancer awareness campaign through different social media channels, through YouTube videos, and also giving online training sessions, group training sessions, and offering one-on-one coaching sessions regarding breast health. So I just had a session a couple of days ago, group of females of different age groups. So it is basically an awareness campaign that I have initiated, because globally, breast cancer is the number one cause of deaths in females, and its number is rising. And the most alarming thing that triggered this campaign and that made me start this awareness campaign is the occurrence of breast cancer in younger females in the 20s and the 30s also. And the irony is that our healthcare system, it is designed to screen females above the age of 40 years. But the risk factors, the warning signs, the time period in which most risk factors are present, that is in the late teenage, in the 20s and the 30s. The hormonal issues, the environmental factors, the stress factors, all the occupational stress and all that. It is most in this time period that they are struggling, they are trying to establish themselves, they are trying to have a family, the kids and all that. So it is the most crucial time of their life when they have to adjust and adapt to different things. But this is the least screen time for them. That no healthcare system is providing them proper breast health education. No one is providing them proper facilities and channels where they can go and ask about different information. If they're experiencing anything, any problem, any symptom, either they will go to a doctor, the doctor will refer them they have to specially ask for any investigation, or it is not provided to them unless they are 40 or above. So this is a ridiculous situation in the healthcare system, that they only care for the diseased. They don't care for the healthy ones who are trying to remain healthy. They don't care for those who want to learn, who want to improve or balance their body, their health, their emotional health, their physical health, their mental health, and their breast health. Because these are all concerned, they are all interlinked. Unless your body is healthy, you can't have a healthy breast health, and it will definitely increase your chance of getting breast cancer. So that's the whole thing that I'm trying to educate, guide, aware each and everyone So this is the whole thing that I have started and initiated.
So I have a couple questions. I'm sure this is, going to benefit a lot of people to hear about this, because when we're kind of younger, we don't think to get checked for this, and we're not advised. So what would be a good age range to start if you don't have any symptoms?
Okay. Now, first I'll tell a little about the latest health statistics that can give an idea that why this age group is at the most vulnerable right now. In studies in 2021, 2022, in the Healthline magazine, it was published, the 15 to 39 years of age, that is the unscreened age, that is the least talked about age group in the females regarding breast health. The number of breast cancer cases are on the rise, and its number is alarmingly rising. So much so that it is becoming one of the most lethal, or you can say alarming thing, that one of the most cause of death in females between 15 to 39 years of age. Breast cancer is among the top 3 now.
Wow, I was not aware of that. That's a pretty high number.
It's a pretty high number, and even there are certain conditions that can mimic, or they can somewhat feel like breast cancer, like having small lumps in the breast. Fibroadenomas, they are called. They are non-cancerous, but unless you get them checked, you are not sure whether this lump is cancerous or benign. So if a female in the late teens, even I have seen cases of 17, 18 years old girl having multiple these fibroadenomas. Last couple of weeks ago, I did a screening ultrasound campaign. I have started that each and every female, I advise them to get screening ultrasound, though it is not part of the routine screening process, but just to make them aware that they should know about their own breast health, even if they are feeling healthy, even if they are feeling fit, they are feeling younger. So in a 19-year-old girl, there were 7 small lumps in right breast and 6 lumps in her left breast. And she was only able to feel one of them while I taught her the exact method how to examine herself. Before that, she just had a complaint of feeling breast pain, constant pain, discomfort, though it was linked with her hormonal issues, it was linked with overall health issues and emotional stress and all that. But unless she get herself checked, or get herself breast ultrasound, she would never know what's happening inside the breast health, what's happening inside breast tissue. So even if any female in late teens, in her 20s, in her 30s, she is fit, she is healthy, energetic, having a good career and all that, but unless she learns the exact method of doing self-breast examination. Now, this is one more point that I have started teaching and giving online lectures on, is detailed self-breast examination. Almost 70 to 80% females, they are not doing it properly because they are not taught about this process properly. Healthcare professionals, they don't have enough time to guide them through all the process. Every female has different size, different texture, different density of breasts. So no one method is applicable to every one of them. Some may require 2 or 3 methods. There are actually 3 methods of palpation of the breast. Usually only one method is advertised, and during the breast health awareness campaign, that in circular motion, you just have to rub and you'll check like this. This only gives up, you can say, a portion of the breast examination is covered, not the whole thing. So that's the thing, that if I will giving you an example, just like a bunch of straws like this, if you are looking at them right away, you will see just 5 small round structures. But if you see like this is a whole tube. Same is the thing, that if you are examining like this in this method, you will only feel that there are small vesicles, small bumps, small balls. But unless you trace it backwards, you won't know that either it's an elongated structure or a round structure. So that's the thing that I guide and teach everyone, that they should be aware of their own breasts. and it should be done on regular basis. Visual inspection should be done on daily basis. Just standing in front of the mirror, it's not just about looking at the size or the skin. It is about finding any small changes that are happening which won't be more evident unless they are more in size or in number, like appearance of small pigmentation marks,
Do you
small
recommend,
moles.
doctor, checking under your axilla as well while you're
Yes,
doing?
yes, definitely. Because this axilla portion, this part, starting from the areola till this part contains the maximum number of ducts, maximum number of glands, and maximum number of lymphatics. So unless a person, a female in her early teens, she is taught about the exact method and pressure and how to examine all the three methods and what she is looking for. This is another thing that only people are told that you have to look for any lump. Lump is one part of the scenario. There are many more things that she should be aware of, like uh, dilated ducts, clogged ducts. Clogged ducts can happen even in the teens without pregnancy, without lactation, without anything. Ductal congestion is a thing that can happen to any female in any reproductive age group. So if they are not told that what they are looking for, if they are just looking for lump, they will ignore all these small things. So these small details, each and everything has its own significance. Some represent hormonal changes, some represent their nutritional status, some represent changes that are occurring in their breast due to improper posture, improper bra use, improper skincare products use.
Wow.
Everything has its own significance and its own side effects, and nobody is teaching them. Imagine,
Yeah, definitely what you're mentioning. I mean, I only heard of the common ones, right? That you've mentioned to look for. So this is amazing that you're sharing this. Let me ask you, is there an example of a case that you could share with people, of course, without disclosing the name of the person or anything like that, that's not very common, that just so people know that this is something that could happen to anybody, right?
okay, so regarding 2 weeks ago, I had a patient. She was 18-year-old girl. She was complaining to her mother regarding breast pain, particularly nipple area pain, pain in the nipple and the periareolar area, the brownish area around the nipple and behind it. So in most countries, I have talked to many people from different countries. Most females, they are just told that in young growing age, in the late teens and early 20s, breast pain is a normal thing. You have to ignore it. It is linked with your hormones, it is linked with your emotions, and it is linked with the growth. So just ignore it if you are feeling pain. Same her mother told her. But it was getting worse and worse. So one day when it was unbearable for her, and she started feeling that one side of the nipple is protruding, it is more prominent, it is hard, painful. So she asked her mother that I should get myself checked, take me to some doctor or something. So her mother brought her. I did a basic examination and I felt that there was something wrong. On ultrasound, there was a 9 cc abscess behind her nipple due to the clogged ducts, and it happened due to improper bra use. She was wearing an improper size and fit bra, which was constantly pressing on the nipples, and due to extreme heat, it is a summer here, summer humid weather. So, due to all these factors, those ducts, those glands were blocked. And due to her growing age, due to her hormonal issues and all that, and improper diet, there are certain diet factors that increase the excretion in the ducts. So,
Could you
due
expand
to
a bit about that, some of that diet factors? I'll be a little interested in hearing about that because I haven't heard that aspect when it comes to breast health.
there are certain items like any seeds, like fennel, like ginger, and like clove, cinnamon, all these herbs and all that. They have a tendency to increase secretions in the breast. So if a person is having any kind of diet, if it is a fatty food mixed diet, like teenagers these days, they tend to take a lot of it. So a combination of this, combined with her growing age, combined with her increasing estrogen levels that were causing her menstrual issues, along with that bra that was not allowing her proper circulation and drainage of the ducts and all that. All these factors combined led to the formation of the abscess in her duct that was clogged, blocked, and it was a 9 cc, this much size cyst that was behind her nipple. So
Wow.
it was just due to lack of awareness and lack of breast and nipple care. Simple tips, simple things that every female should know and should learn. And the doctors and the healthcare professionals should be able to provide a proper coaching system or something like that in their school and the universities and colleges. That this is a part of the body which requires some certain extra steps. Like nobody tells that normal soap or body wash is harmful for breast and nipples. Nobody tells this to girls because every soap that we apply on the skin, it has a tendency to clean the skin but also make it dry. It wipes out the oily layer. So nipples tend to be a softer and very sensitive part. So when their little moisture layer is wiped off, it tends to crack. It tends to become dry. It will become flaky. And also these small cracks, repeated changes, along with if the bra, inner side of the bra is not that much soft, if it has any kind of layer that is a bit of rough. So imagine this rough surface rubbing on a dry nipple or any part of the skin that is dry, along with heat and the moisture. So all these factors, they will definitely damage the skin. These are
Wow.
small details that every female should learn and be aware. Not everybody is going to tell them on daily basis, but this is some simple observation that every female should learn. So that's the thing that I've been trying to make this point clear to every female, that they should be aware of their own breast health and body health. And particularly, this is important in the younger age group, in the late teens, in the 20s and the 30s, because the foundation you lay in this age, it's going to benefit you in the later years. And the same thing, the risk factors that are present in this age, they will definitely worsen in the later years.
I've also heard about some deodorants that may cause, increased incidence of breast cancer. I don't know if you've heard about that.
Actually, that is more linked with the use of any deodorants that have different chemicals in them, as they tend to block the outer excretion of the glands. Because the skin, they form a layer, a barrier on the skin, and the normal sweating is blocked. Those glands and ducts are blocked to produce sweat. So whenever there is a blockage, it tends to make the ducts clogged, same in the way that her abscess were formed. So these changes can cause lymph node swelling, lymph node pain, repeated infections, but their link with formation of cancer is a very long process, not a direct link that you use this and you will get this. It's not like this. Small steps, one by one, if factors add up, 1, 2, 3, 4, 5, then definitely it will cause the increased risk factor. But it is not a direct risk factor. Indirectly, it can cause symptoms that may mimic that a person may have a breast cancer, because there will be lymph node swelling. But it can be caused by multiple factors.
And how often do you think a healthy woman under 30 should get, let's say, an ultrasound if they have like fibrocystic breast, let's say, just to kind of monitor, the size and making sure it's not, you kind of catch it on time?
Okay, fibrocystic breast, first of all, we have to identify the factor that caused fibrocystic changes. It is the excess exposure of estrogen on the breast glands and the ducts. So if imagine a girl who got her menstruation by the age of 12 years, and she is 30 now. In these 18 years of time span, she didn't get pregnant, so she didn't lactate. So 18 years of this unrestricted exposure of estrogen on her breasts when her breast stopped increasing in size at the age of 20 or 22. After that, it was just the exposure of estrogen on the glands and the ducts that caused them to increase in their volume. The volume is increasing, the overall size is not increasing, because the body growth is almost complete by 20 to 22 years of age, and some 25 years of age, and not later than that. So it is just causing those glands and ducts to work more and more due to increased estrogen levels. But this unrestricted, uncontrolled exposure, because in some females there is excess of estrogen levels due to certain conditions. So it causes fibrocystic changes, formation of small cysts, small dots in and the thick tissue in the breast. And it is palpable in the breast, like one part of the breast may feel a bit hard, bit tense, tender. It will have less relaxation sensations on any palpation or massage than the rest of the breast. So ideally, now what I have started in my clinical practice, that I'm offering every female above the age of 18 years that you should get it yearly at least. Because you never know when you start developing any kind of lump, any kind of duct congestion. So if a person who thinks that she may have a tendency of getting any kind of breast issue, not just cancer, like fibrocystic changes, like duct dilatation, like if she is feeling that her breasts are more heavier or more painful most of the time, which is not triggered by any hormonal change. So if she is feeling any kind of discomfort, it is better to get it checked. So by standard, no healthcare system has devised a certain period of time that you get it checked weekly or monthly or yearly. But I simply guide each and every one of them, just due to increasing number of cases around me, in my family also, in my friend circle and all that whenever you feel a complaint, just get it scanned. Secondly, try to get at least once a year ultrasound scan, because it doesn't contain any radiation. It is cheaper than any other investigation. It is readily accessible. Also, you can track your own breast health. It is all about knowing and understanding your own health and caring for it. So as many steps you can take, which are in any healthy way without any radiation exposure, so you should adopt it. And secondly, detailed self-examination once a month and visual inspection as many times a month she can do. So there are some standard protocols of doing this self-examination, and there are some added steps that can be added to this main protocol that can aid in determining or knowing own health much better way than conventional methods. So,
Doctor, sorry, go ahead.
Yeah, so you can ask. Okay.
Okay, I was going to ask. Let's say you did your ultrasound and they found some small bumps, but they're benign. There's no issues, and then you're just going to monitor. Is there any because I've heard a lot about like home remedies, for example. And I know, kind of like the Western medicine kind of deals with it a little differently, but, for those people that are listening or in your experience, stuff that people have tried, not necessarily prescribing it when they're listening to us here, but just kind of like general knowledge, talking in general, if you've heard any like oils or any, specific supplements or anything like that can kind of aid in the process while you're kind of just monitoring what's going on?
Yes, definitely. There are few exercises that every female, every teenager, every age group female should do on regular basis. There are a couple of them. I'll demonstrate to you. These exercises help in maintaining a normal circulation and drainage of the breast ducts, breast glands, breast vessels, and also they help in maintaining a normal skin tone and muscle tone. So these the one basic exercise is the round flapping movement of the arm, this round movement. This helps in maintaining the strength of these muscles. As these muscles are strengthened, it will have a beneficial effect in maintaining a good circulation. The second thing that is very easy and very practical for the whole It is a calming movement. This calming movement. This is strengthening this whole shoulder muscle, this shoulder area. These are rotator cuff muscles. These pectoral muscles on which the breast is resting on. Okay. So, and also this allows the drainage of the ducts towards the axilla, because all the glands and ducts, they are towards the gravity. Lower, they have a tendency to get clogged or pulled downwards due to gravity. So when we are trying to push the blood or secretions away from the gravity, we definitely need some kind of push. And these exercises, they help in moving it, circulating it. The third thing that any female can do is like the wall press, like this movement against the wall presses.
Oh,
It
wow.
helps in strengthening these muscles a lot. And also there are few things that like any growing teenager, any female in the 20s and 30s, it adds to their it has a lot of cosmetic benefits also, like it reduces the tendency of sagging breasts. It is very common in late teenagers in the 20s due to bad posture, because whenever a person is working like in the corporate environment, in they're studying, or any freelancers also, like they tend to sit 6 to 8 hours or 10 hours on this screen and all that. In that time, if they are sitting like this, imagine the whole blood and the structures, they are hanging downwards, and if they are wearing improper support bra, so it adds in making the breast more engorged, more tense, and also it increases their tendency to get sag, even in their 20s and late teens, even without getting pregnancy, even without lactation. So these all things, they require little bit of correction. Posture correction is very important for every person, because without proper posture, the back is not supported, the upper chest is not supported. They will always feel pain in the cervical region. So this is very important, cervical. Same is the standing posture, because if they are standing with a little hump on the back and like this, it means they are exposing their muscles to be more relaxed. The body will feel relaxed, but the muscle will get weaker and looser. They will loosen up, the skin will loosen up, the connections, the small ligaments that are present in the breast, they will break over time because they are not supported. Improper bra is a very dangerous thing. It has lots of hazards, not just by the skin changes, it causes inner glands and ducts changes, it damages nipples, and it also has a harmful effect that it will always give the back pain, the shoulder area pain, the neck pain due to improper support or excessive stretch. So one thing is posture correction. Second is learning and understanding what their breast type is, not just size, their type. There are different breast types. They have to select the bra according to their size, band size, cup size, and their type. So these all factors. And regarding the massages, any natural oil like olive oil is a very good thing. Coconut oil is a very good thing. It helps in maintaining the skin texture. It helps in avoiding skin dryness, and also it provides a certain barrier on the skin due to any rub, any kind of fabric rub and all that.
Okay.
Applying that is a good thing. There are massages, but special massages for every breast type, and also some help in improving circulation of the breast, some help in improving the lymphatic drainage, some help in breast growth, some help in breast texture and the skin tone improvement. So depending on the age, on the size and type of breast, different massages, I guide and teach all these steps, but they're all personalized things. The generalized thing I have mentioned that every female should learn and understand. But the customized thing that everyone should learn according to her own body type, those can be taught only in one-on-one session when they can ask the particular questions and their body health is considered while guiding all these steps.
Doctor, and do you see only patients in person, or can you see them like through Zoom, or do you have group classes, or do you have webinars, or how do you, uh, what is it? How do you provide the service, or, do you have like teaching seminars for those that are just getting started that want to learn more about it, or what kind of services and how are they offered?
I offer online group sessions, group training sessions. Those group sessions are all free for everyone.
Wow.
Everyone can attend. And last Sunday, it was regarding breast skin changes in the breast and the nipples. Before that, it was regarding breast pain, different kinds of triggers, different kind of pains, and how to home remedies for pain management. It was taught. Before that, I taught about detailed self-breast examination, how to do it. So on regular basis, I'm arranging these community awareness sessions, and these all through Zoom. So there are different cancer support groups that I am part of. So to provide them support, to provide them reassurance, and also I offer them free consultation regarding their reports, ultrasound reports, mammogram reports, their follow-up, and all that. They keep texting me, and I try to respond to each and every one of them. So and regarding one-on-one sessions, I will be starting them as an organized, you can say, organized way in a couple of weeks. There will be proper a website to schedule there. There will be different, you can say, packages or different ways they can learn and understand all these things. The basic one will include all these tips that I have mentioned briefly: basic exercises, massages, skincare tips, guiding them to detailed examination depending on their breast type, and also teaching them which are avoidable factors in their own lifestyle that should be modified to reduce the risk. The more detailed one will include their assessment based on their investigations if they have done already, like reporting the mammogram and sonogram and guiding them according to these. And there will be a whole package which will include one-on-one session with them for 5 sessions. For follow-up, one will include a dietitian that she will definitely guide that patient regarding that person, healthy person, any entrepreneur, any working woman, or any housewife, that what dietary and nutritional changes she requires depending on her activity, her hormonal balance, her age, personalized items. One will include a session incorporating a psychological assessment regarding how to manage stress, work stress, home stress, and anxiety, and any kind of phobias, any apprehensions. So a psychologist will be on board. So it will be a whole holistic approach along with the medical approach that I'll be starting, that each and every female requires not just the medicine or the pill, not just a simple reassurance that she will be okay. It's not like that. You have to guide her through each and every step depending on her own health status, her hormones, and her own living lifestyle. That she should be able to care for herself, remaining in her lifestyle. We don't have to put her in some special place that this place will make you safer. It's not like that. There is stress all around us. Some part of it is manageable and some is non-manageable. So we have to encourage and try to guide and teach her how she can cope with all these factors and try to keep herself healthy, not just the breast health, but overall emotional health, physical health. So it requires a holistic as well as medical approach combined together in different 5 to 6 sessions. So all these will be provided to them depending on their own understanding or their own convenience. They can opt for any of these packages.
Wow, I'm actually really happy to hear the approach that you're taking on women's health and on this issue, to kind of give a 360, approach it in a 360-degree way, because, I come from a healthcare background. Before I used to do that, and seeing how it's evolving and how we're thinking beyond a prescription, beyond a surgery. It's beautiful. It fills my heart that you're doing this type of work, and also the balance that you bring into the space, right? You being a male doctor, working with females and supporting us through this process. It's amazing. I love the fact that you're enter into the space to provide all this healing and all this guidance for us. And how you're open to doing that. All the packages sound amazing. Is there a preferred way to contact you, a website or a social media or a phone number or anything that you'd like to share for the audience to get a hold of you? If anybody's interested.
Everybody or rather anybody can visit my website that is regarding breast health and cancer awareness. It is a free resource. It contains each and every information regarding breast health, breast cancer, different treatment types, different options. So it contains all the information. It is bebreastaware.org. 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 And there is a sign-up form that anybody can contact on that. I'll get an email reminder of it. They can contact me through Facebook, just the way we had a contact and chat. Facebook is an easy way for me to interact with patients. So anybody can contact me, even they're feeling healthy or anything, just to clear their concepts and to know what options they can have in improving themselves. They can contact me. I can share that address, the social media also, and also they can contact me on LinkedIn. But Facebook is easy, accessible to everyone, and hopefully in a couple of weeks I'll initiate the whole website also that will include all the information regarding the one-on-one coaching sessions. So they can register on that, and definitely it will be a process that will require proper awareness, because the most important thing is awareness that there are resources, there are helpful material, there are helpful coaches that are there to help. If somebody can reach out to them, because like me, I try to be involved in different communities, in cancer awareness groups and in healthcare groups, just to make sure that everybody gets the message that there are resources available for them. They can get a basic approach in free sessions. Nothing is charged, nothing is asked for, anyone can join. But if they want something that is systematic, that concerns their own body, that is relevant to their health, their lifestyle, and that can incorporate all the aspects all together, definitely they should opt for the one-on-one coaching session. So there are different packages, as I mentioned, that anybody can choose which thing suits them the most. So It's all about self-care and self-learning.
And do you accept insurance, or is this like a private practice, private pay?
It's a private pay.
Okay, that's fine. Yeah. Do you have any type of like payment plans or anything like that at this moment?
At this moment, I'm under the process of, can say, trying to make all these in a systematic way. The website is under development. My company, it's under registration process in the Maryland. So all these things are going on side by side, but till that time, I'm available for all the free consultation and all that. So
Awesome.
Anybody can contact me till that time. And even after that, free resources available for everyone.
Perfect. Since you're looking into all this, I mean, you don't have to, it's just an idea. Like a lot of the times when I've had to use services that are private pay in the healthcare sector, I used Care Credit. I don't know if you've ever heard about it, but it's like a line of credit. And then you get reimbursed just like like a regular credit card. But that might be something good for people that can't afford it all at once. So you get like 12 payments or no interest for 12 months. And then you get all your money up front. So it could be something to look into if you're interested. Thank you, Doctor, for everything you've shared. I mean, I've learned a lot in the few, in the minutes that we've been together here and everything that you've shared. I'm going to add on the podcast description all of your contact information, your website, as well as your Facebook and social media, so that people can definitely contact you and, just reminding them that they can join the groups, just to kind of get a feel for it and then go from there and join one of your packages. Thank you so much for being on the podcast today. We appreciate
Honor.
having you and learning from you.
Honor's mine. Thank you.
Thank you so much for listening. For more, follow us on Instagram at Quantum Alchemist Master.